Welcome back, everybody. It's Ask the Expert, our final segment with JB Robillard from Robillard Hearing Centers, and we got a few questions to answer. We'll try and get to yours, hopefully. Kay is joining us. Is Kay on the telephone all set to go?
Yes, we are.
Hi, Kay. How are you?
I'm actually pretty good.
Good. What's your question today?
My question is, as a child, I had hearing problems throughout my life. I had tubes in at the age of 2.
Right.
By 4 years old, I had them out. At the procedure of getting my tubes out, I ended up getting this clinical trial testing for way of healing.
Right.
Where one ear would be naturally healed, nothing was to be on it, nothing to disturb it, while the other ear had a clear contact on the eardrum, or in the middle ear, I can't remember.
Right.
And because of that testing, I ended up getting tissue damage in my ear, and now I'm on the borderline of being deaf. And I have the issue that my daughter might be having the same problems as me. Mm-hmm. And they're talking about putting tubes in her ears. And since I've had bad issues with that most of my childhood, I was wondering, should I be still considerate of giving my daughter the tubes, or should I consult you guys?
Right. That's a very good question, because this always, this harkens back to some years ago, obviously, when the technology wasn't as good as it is today, right? Mm-hmm. So there are many things you can determine today that you couldn't 20, 25, 30 years ago.
It's possible. There's been a lot of advancements in middle ear surgeries, of course. But really, the best thing to do is to refer to your ear, nose, and throat doctor. I mean, he would be the best consultant. The thing with tubes is generally they prevent mastoidectomies. I mean, they're typically essential.
What are they there for, JB? To just drain fluid?
That's it exactly. That's exactly, and they're very important in clearing up the infection. So obviously, you want that infection behind the eardrum to resolve.
Right.
If it doesn't, it can create some major complications. And so tubes are. They're actually, they're very beneficial.
Yeah.
But it's not uncommon to have scar tissue left over from a tube, and additionally some sort of residual middle ear hearing loss.
Right. Is that use of tubes for drainage and so on still prevalent today as it was some years ago?
Yeah,
is that right?
It hasn't changed very much.
Really?
No. Yeah, it's used quite commonly.
Yeah, the technology though behind hearing aids is what has improved greatly.
That's right.
In recent years, especially.
Absolutely.
So the first step, go see your ear, nose, and throat specialist.
Yeah, I would refer to your ear, nose, and throat doctor and just address any concerns that you may have.
Right.
And just speak to your physician very carefully and address those points that she did with us.
Yeah.
And by all means, we can always provide if there are other solutions that. For instance, if it does come down to amplification, if they are interested in pursuing that route and correcting her hearing loss, because she did mention she's got a significant hearing loss on one side.
Right.
So there may be some options for that as well. So typically with a conductive hearing loss, where the hearing loss resides in the middle ear, where it's associated with the eardrum, as she mentioned, very often those are pretty easy hearing losses to address.
Really?
Yeah, very often it's quite simple. It's quite straightforward.
It's once you get into the inner ear area that things get a little complicated.
Yeah, when the inner ear is damaged, when comprehension is reduced, okay, then that's a little bit more complicated.
Okay.
But when we're talking about the middle ear, well, in that case, usually the processing ability of the ear is unaffected. So it's just a question of straight power, just straight amplification.
Yeah.
So usually that's quite simple.
Let me ask you this. A lot of people wonder if a hearing aid is the absolute solution to their problem. And I know that each case is individual. There's no question about that.
Right.
There's no guarantee that a hearing aid can restore your hearing completely, correct?
No, there isn't any guarantee at all. It depends on the severity of the hearing loss. I mean, the technologies that we have today are far more efficient. They're far more aggressive.
Yeah.
From a clinical point of view, what we can do, how we can address your hearing loss. Basically, the whole concept behind the hearing is to get you back up to hearing normally, a normal hearing threshold.
Right.
Of course, it's an artificial normal, right?
Right.
And really, what hearing aids are, it's a whole new auditory system. It's an artificial way of hearing.
It's not the same as it's
and it's not going to be as good. It's not but with today's technology, I mean, there's a significant improvement. There's a very considerable improvement.
Right.
But I think the point that I'm leading to regarding artificial hearing, there is almost a rehabilitative aspect to it. It's a question of learning to hear through this new system, through the hearing aid, and that takes some time, you know. And I think that's what sometimes people are a little surprised. They don't realize that they have to adapt to the instrument as well. And that's usually the biggest challenge.
It's a different way of life. There's no question.
It really is. Yeah.
And I know we're out of time. We got to run, but I know that hearing loss, be it gradual or or being even the slightest, has got to be one of the most frustrating things for people to deal with. The answer is go see a specialist, go to a hearing center, get yourself tested, and that way people can look after you as things move along.
Absolutely. Right? Be proactive, figure out where you're at.
Don't ignore it.
Exactly. It's like any other, hearing loss is like any other problem. If it's left ignored, typically it's going to get worse. It's going to deteriorate. So be proactive, figure out where you're at, and figure out what your options are. Listen,
get in touch with JB Robillard and Robillard Hearing Centers by going to one of their locations or getting on their website. Call and make an appointment. That's what they're there for, to help you out. So like JB said, be proactive and you'll be better off for it. That's Ask the Expert for this time around. We'll be back with more of CTV Morning Live. We're going to play some floorball and have some fun right after this. We'll be right back.